Well, it's a beautiful day here in San Diego, and we are so pleased to be joined by Dr. Saul Levin, Medical Director and APA CEO. Thank you for sitting down with us.
Thank you so much for the invitation to come chit-chat about this wonderful meeting.
Well, let's talk about that. Let's kick off with that. So the membership of the APA is at its highest level now, I believe, for 14 years.
Correct.
What do you put that down to?
So I think it's, this is my 4th year in the job. I am a member. I've been a member since I was a resident. And I believe we're a membership organization. So while you truly want to also get more to the public and to the larger parts of the country around destigmatizing mental illness, the bottom of the line is it's our members who we've got to take care of. And we've become very member focused. Simple little things. If a member emails us, if a member calls us, we may not have the answer right away, but we'll tell them, we'll get back to them. And the members are really resonating to it. And also I have a terrific group of chiefs and directors who have truly begun to find out what do the members want. And we then create those educational toolkits that really make their practice easier because of what we're giving them. And the fact that we're literally at over 37,000 members,
wow,
highest since 2002, is showing that the members are resonating. And the younger members are coming in as well and staying.
It's definitely important. I want to talk about something that you've just launched, Psych Pro, a mental health registry. So tell us about it. How does it work?
So I have to commend the board and commend the membership for also saying that we really need to do it. We're one of the last specialties to create a population-based registry of data on mental illness. So it's not just going to be for the psychiatrists, it's going to be for the family practice docs, the internists who see a lot of people with mental illness, be it depression, anxiety. And essentially what it is, your doctor talks to the patient and says, you fill out these forms for us. Let's say you say you're depressed, well, I want to see how depressed you are. And then that would go into the registry, and when the patient comes back after some treatment in a few months, they give them the form again, the assessment tool, PHQ-9 is what it's called, and they can see, has the patient improved? If they haven't improved, well, let's do it. The registry helps them keep track of that.
Another big thing is the telepsychiatry toolkit. Tell us a bit about that.
We have 320 million people in this country. We have in the mental health arena maybe 600,000 between the psychiatrists, psychologists, social workers, addiction counselors, nurse practitioners. There aren't enough of us to be dotted around in every town and every city. So telepsychiatry is the way to do it. And the toolkit walks you through it one step at a time to say this is how you do it, this is the best way to do it. Work with if you're going into another state in telepsychiatry, and it brings psychiatrists and their expertise right into some area that may never have had that expertise. And that's the wonderful thing about this toolkit. Easy, accessible, and helpful.
Now, Dr. Levin, we're in San Diego. We're thousands of miles away from Washington, D.C., but never that far away, are we? Now, what are some of the things that are going on in terms of legislation that are affecting mental health? So
the wonderful thing about what's happening now in this country is people are beginning to pay attention to mental health and mental illness. So for once, everyone is beginning to say, I do know someone with a mental illness or substance use disorder. And the legislators are beginning to realize, as is the medical profession who's been saying it for a while, that it's very rare that you will have a patient with only a primary care illness. You get anxious, you get depressed, and they're beginning to pass legislation. We just had under the 21st Century Cures Act, which gave more money for research, across the board of healthcare, but also for mental health and substance use disorders and alcohol abuse. But alongside of it, it's also now said that we need to have parity, that you cannot treat mental illness differently to what you would treat a primary care illness differently. And that's what's happening. Clearly, whether it's the Affordable Care Act or whether it's the American Health Care Act, I think what we're seeing in Washington, D.C. is that we don't want to reinvent the wheel. What works, let's keep it, and what doesn't work, let's improve on it. And I think that's what we hope is going to come out of this at the end of this coming year.
Well, thank you very much indeed for joining us today. We hope you have a great week here in San Diego.
And welcome back. It's wonderful to see you again, and come back again next year.